Pushback tonight from the University of Nebraska system. Leaders claim they're not trying to take over Nebraska medicine. Good evening and thanks for joining us. I'm Brian Mastery.
And I'm Erin Sullivan. This comes ahead of a Board of Regents vote on Friday on this $800 million deal that would give the university complete control of the health system. Our Brenna Kiefner joins us live from the newsroom. Brenna, you spoke with the university system's president about what this all means for patients. What did you learn?
Erin and Brian, Dr. Jeffrey Gold says the deal is not a state takeover, and he wants patients to know that nothing will change when it comes to their care. As we first reported on Friday, the deal would end a nearly 30-year partnership between Clarkson Regional Health Services and Nebraska Medicine. According to Dr. Gold, Clarkson actually approached the university a year and a half ago, saying it wanted out of that joint membership of Nebraska Medicine. Under the proposal, the university would pay $500 million for Clarkson's stake in Nebraska Medicine, plus $300 million for land and buildings. Clarkson would also donate $200 million to the university's Project Health, which is the largest single gift in university history. But Nebraska Medicine's board is fighting back, calling the move a state takeover that could hurt patient care. The health system says the deal is being negotiated without their input and warns it could threaten the independence of medical experts. But Dr. Gold, he strongly disagrees.
It's very important for the community to understand that if this were to happen tomorrow, nothing is going to change in the quality, access, affordability of their care. Nebraska Medicine is an extremely well-run, well-governed organization that is in complete control of those decision-making activities.
And Dr. Gold also said no one will become a state employee and patients should only expect improvement and expansion of services. I will be talking with Nebraska Medicine tomorrow about their concerns. In the meantime, you can find their response to the announcement on our website.
So, Brenna, this is obviously a very contentious situation. How did Dr. Gold describe the split to you?
Dr. Gold, he actually used a really interesting analogy, Erin. He called this an amicable divorce, with one parent organization being done with the partnership. So from his perspective, the university is just responding to Clarkson's request to leave, but not forcing the change. Live in the newsroom, Brenna Kiefner, First Alert 6.
We'll have to see what Nebraska Medicine has to say to you tomorrow, Brenna. Thank you. Now, we've also seen concerns about how the plan will be financed. Today, Dr. Gold said it will not touch the academic budgeting from the state or tuition dollars. Instead, he says it will be financed through a combination of structured debt, letters of credits, and monetizing real estate.